Hello everyone, and welcome to another day of high-yield USMLE questions. So this is a 50th question in the medicalized question bank, and this question is going to be on screening. It's the first screening question, and it's going to be helpful for USMLE Step 2 CK and Step 3 students. So we have a 65-year-old male patient presented to the emergency department due to sudden onset confusion. The confusion started 4 hours ago. Past medical history is remarkable for diabetes, hypertension, and cirrhosis. Widely, the patient has blood pressure of this. The patient vitally is okay. On examination, the patient is not oriented to time, place, or person, and has telangiectasia and over the chest and gynecomastia. So these are the features of cirrhosis. So if they ask what causes the telangiectasia and gynecomastia, in cirrhosis, this is caused by something called hyperestrenism. Increased estrogen causes a few things in cirrhotic patients. First, gynecomastia. Second, telangiectasia. Third, palmar erythema, for example. So these are some of the things that, and testicular atrophy is another. So these are the things that hyperestrenism will do in cirrhotic patients. In male, obviously, you will have gynecomastia and testicular atrophy. Telangiectasia, palmar erythema can be seen in females. So as hyperestrenism features. So this is cirrhosis, and the patient probably is having hepatic encephalopathy. The rest of the examination is unremarkable. The patient is started on lactulose and rifaximin, and his condition improves. So this was hepatic encephalopathy, and the patient condition has now improved because you've given lactulose and rifaximin. This patient should undergo which of the following tests? So remember, this is screening test. If someone has cirrhosis, they are at increased risk for hepatocellular carcinoma. So how do you screen for hepatocellular carcinoma? Ultrasound every 6 months is the right answer. AFP you can do at 6 months with ultrasound, but it's like plus minus ultrasound plus minus AFP. Remember, AFP has low sensitivity and specificity for detecting hepatocellular carcinoma. It is only raised in 60 to 70% of the hepatocellular carcinoma cases. The remaining 40% of the hepatocellular carcinoma does not have any elevation in AFP. But if you see an AFP that is very high, like levels are greater than 500, that can be a diagnostic of hepatocellular carcinoma. Hepatocellular carcinoma cause AFP to be through the roof. So remember, ultrasound every 6 months plus minus AFP every 6 months. So you may or may not do AFP with it, but it's not at 9 months. So this is a wrong answer. CA19-9 is a wrong answer. So this is the something that you do for pancreatic cancer, but you don't do it as a screen. You don't screen anyone with you don't do this as a screen. This marker, it's not very a good marker. It's not going to be even diagnostic. It's just suggestive. It's not diagnostic, so it's not used for diagnosis and screening. And then we have a CEA. This is done for colorectal cancer. Remember, this is also not a very good screening test. So you don't do it every 3 months, for example, if someone is at risk of colorectal cancer. So the right answer here is ultrasound every 6 months, and to look for hepatocellular carcinoma. So I hope this video was helpful. This was first screening question, and remember, screening questions are high yield for USMLE Step 2. If anyone requires PDF of my screening, I have USMLE Step 2 CK notes, and they can find it in the description below in my channel. Also, if anyone requires tutoring, they can email me here. See you in the next video.